We begin with Chief Congressional Correspondent Mike Emanuel, who joins us live from Capitol Hill tonight, where lawmakers are getting their first look at these numbers. Good evening, Mike.
Well, that's right, Brett. Good evening to you. The Congressional Budget Office projects 14 million people would lose health care coverage next year with this Republican health care proposal. By the year 2020, it estimates 21 million fewer people would have health care coverage. That number would grow to 24 million in the next decade. The CBO also predicts the GOP plan would decrease the budget deficit by $337 billion over a 10-year period. Senior Trump administration officials came out quickly to say they strenuously disagree with that coverage assessment.
We believe that the plan that we're putting in place is going to insure more individuals than currently are insured. So we think that CBO simply has it wrong.
Speaker Paul Ryan has been bracing for a bad projection because this Republican package doesn't force people to buy insurance.
The one thing I'm certain will happen is CBO will say, well, gosh, not as many people will get coverage. You know why? Because this isn't a government mandate.
The White House budget director noted the CBO was wrong on health care before.
If the CBO was right about Obamacare to begin with, there'd be 8 million more people on Obamacare today than there actually are.
This morning, the president predicted on Twitter the GOP will unite and blasted the current law. Obamacare is imploding. It is a disaster, and 2017 will be the worst year yet by far. Republicans will come together and save the day. Top Democrats are taking swipes at the president.
Like much of his administration thus far, Trump care is another game of say one thing, do another.
One conservative critic said on Fox News Sunday the president is willing to cut a deal.
The president's been very clear that he wants negotiation. They're open to change. I hope they'll work with us. I hope they'll have the same. I hope the speaker and our leadership will have the same attitude the White House does, which is let's work together and find a plan that works for the American people.
And one Senate conservative urged Jordan and others in the House to hold the line.
Do not walk the plank and vote for a bill that cannot pass the Senate and then have to face the consequences of that vote.
But the president and Ryan have suggested failure to fix the problem could lead to a bloodbath.
I do believe that if we don't keep our word to the people who sent us here, yeah.
And this afternoon, the Senate Majority Leader reiterated the need to act.
Healthcare markets are teetering closer to the edge of collapse. The Obamacare status quo is simply not an option. We have an obligation to the American people to repeal and replace Obamacare.
The next step is the House Budget Committee is expected to take the two separate components that were assessed by House committees last week and combine them into one bill. It is still early here on Capitol Hill with people returning from their home districts, but it seems those who like the package found something to like in the CBO projection or disagree with it, and those who dislike it are still against the plan. Brett?
Mike Emanuel live on the Hill. Mike, thank you.